Assalamu alaikum. Today we'll be studying about dental manpower. So what is a dentist? Dentist is a person licensed to practice dentistry under the law of the appropriate state, province, territory or nation. So in order to be a dentist, you need to have certain qualifications. And these are completion of an approved period of professional education in an approved institution and demonstration of competence. So you need to be professionally educated and also you need to be competent as well. So the dentist is legally entitled to treat patients independently. So independently means the dentist does not need any other people to help him or to guide him for his procedures, his specialty. Registration. So whenever you become a dentist, you are registered, and that process is called as registration. So registration is the process by which qualified individuals are enlisted on an official roster maintained by a government or non-government agency. Dental auxiliary. A dental auxiliary is a person who is given responsibility by a dentist so that he or she can help the dentist render dental care, but who is not himself or herself qualified with a dental degree. So the dental auxiliary does not have dental degree, but he just helps. Okay. And classification by WHO 1967. These are non-operating auxiliaries, operating auxiliaries. Non-operating auxiliaries are divided into clinical and laboratory. Clinical, this is a person who assists the professional, that is the dentist, in his clinical work, but does not carry out any independent procedures or anything in the oral cavity. And laboratory, this is the person who assists the professional by carrying out certain technical laboratory procedures. Operating auxiliary is a person who, not being a professional, is permitted to carry out certain treatment procedures in the mouth. So this operating can conduct procedures in the mouth, and he should be under the guidance of the professional, that is the dentist. Now we have the revised classification. So this is non-operating and operating. Alright, but the non-operating and operating here, it is divided into certain subdivisions. Non-operating has 4: dental surgery assistant, dental secretary receptionist, dental laboratory technician, and dental health educator. The operating one has 4 subgroups as well: dental school nurse, dental therapist, dental hygienist, and expanded function dental auxiliary. Dental surgery assistant. A dental assistant is a non-operating auxiliary who assists the dentist in dental hygienist, who assists the dentist or dental hygienist in treating patients, but who is not legally permitted to treat patients independently. So he also assists. Assistant means he is assisting the doctor, he is assisting the dentist, but he is not legally permitted to treat the patient independently. History. So there was a man, Dr. C. Edmund Kells. He was from New Orleans. So he hired a woman as a lady in attendance so that the ladies who needed dental treatment during these Victorian times were made to feel at ease. Okay. So what happened is, we'll study about the four-handed dentistry a while later. Just need to tell you that assistant may only work under the supervision of a licensed dentist, carrying out the duties prescribed by the dentist or by the dental hygienist employed by the dentist. So if we have a dentist here, okay, so, and we have a dental assistant here. So either the dentist or the dental hygienist, these two people can assist and get this dental assistant to work, but this person cannot have his independent role in working for the patient, right? He can only be guided by these people. Now, four-handed dentistry. The term four-handed dentistry, four-handed means you are having 4 hands. So a person cannot have 4 hands means there are 2 people, okay? because each person has 2 hands, so 2 people will have 4 hands. So it means that the procedures will involve 2 persons. Okay, so the term four-handed dentistry is given to the art of seating both the dentist and the dental assistant in such a way that both are within easy reach of the patient's mouth. So the patient is in fully supine position. The assistant will hand the dentist the particular instrument he needs. She will also perform additional tasks such as retraction, aspiration. The dentist can thus keep his hands and eyes in the field of operation and work with less fatigue and greater efficiency. So, duties of dental assistant: reception of the patient, preparation of the patient, preparation of facilities, sterilization of the instruments. Then we have some other things like preparation and mixing of restorative materials, including both filling and impression materials. Then we have the care of the patient after treatment until he or she leaves, including clearing away of the instruments and preparation of the instruments for reuse and blah blah blah. Okay, so also he performs instructions. He gives instructions to the patient where necessary in correct use of toothbrush, for example, right? Now, dental secretary or receptionist. So this is a person who assists the dentist with his secretarial work and the patient reception duty. So he's doing secretarial work and patient reception duty, as the name suggests. Now, dental laboratory technician. So a dental laboratory technician is a non-operating auxiliary who fulfills the prescriptions provided by the dentist regarding the extra-oral construction and repair of the oral appliances and bridge work. Okay, so this category of personnel also have been known as dental mechanic. So they are also known as dental mechanics. So they receive training through apprenticeship associated with formal training period of 2 years, and they have certain duties as well. For example, casting of models from impression made by the dentist and fabrication of dentures, plants, orthodontic appliances and all those things. So WHO has given a definition of dental mechanic. So WHO says dental mechanic is a person who makes or repairs dental appliances or dentures, including inlay, crown, bridge work. He shall restrict his activities to purely mechanical laboratory work at the instance of a registered dental surgeon. He shall not do any chairside work. The Dental Council of India. Hey, this is by the Dental Council of India. I'm so sorry. Denturist is a term applied to those dental laboratory technicians who are permitted to fabricate dentures directly for patients without a dentist's prescription, right? So this person, he can make dentures or you can say whatever, without dentist prescription. So the dentist is not involved here. Dentist does not have any kind of role in this, right? Oopsie, let me erase it. So denturism, the craft is called as denturism. So the ADA defined denturism as fitting and dispensing of dentures illegally to the public. So the question arises, is it illegal? So according to ADA, it is illegal. Now, Tasmania. So there are several countries which have allowed the laboratory technician to work directly with the public. So Tasmania is such a state, which is in Australia. And here the technicians were, they were allowed to provide prosthetic service. Denmark is other state, which uses the term denturist to describe a special category of dental technician who sits at an examination to enable him to prescribe, make and fix removable dentures without supervision. Okay. Now, dental health educator. So this is a person who instructs in the prevention of dental disease and who may also be permitted to apply preventive agents intraorally. So you can apply the preventive agents, for example, this tube, for example, if this is a preventive agent, so he can apply into the patient's mouth, right? Very horrible drawing, I'm sorry for that. Now, something about Sweden. In Sweden, 2 additional weeks of training are given, after which auxiliaries are allowed to conduct fluoride mouth rinsing programs to group of school children. Okay. Now, school dental nurse. So this is an operating auxiliary who is permitted to diagnose dental disease and to plan and carry out certain specific preventive and treatment measures, including some operative procedures in the treatment of dental caries and periodontal disease in a defined group of people, usually school dental nurse. So it means that they are involved with children, they treat the children. So what they do, they carry out special preventive as well as treatment measures also. Means they can also provide caries treatment, periodontal treatment for the deciduous dentition. So this scheme was established in Wellington, New Zealand, 1921. Training period given to the people is 2 years. And duties. So they do oral examination, prophylaxis, topical fluoride application, advice, LA administration, that is the local anesthetic administration, amalgam filling, pulp capping, extraction of the primary teeth, patient instructions. All those things the school dental nurse can do. Apart from this, classroom and parent-teacher dental health education can also be provided by the dentist, by the school nurse. Dental therapist. This is an operating auxiliary who is permitted to carry out to the prescription of a supervising dentist a certain specific preventive and treatment measures, including the preparation of cavities and restoration of teeth. Alright. So this is an operating auxiliary who is permitted to carry out to the prescription of a supervising dentist, means under the supervision of a prescribing dentist, certain specific preventive and treatment measures, including the preparation of cavities and restoration of teeth. So in UK, these are called as dental dressers training. So they receive a training for about 2 years, and they have certain duties that like clinical caries diagnosis, cavity preparation in deciduous and permanent, vital pulpotomy under rubber dam, and extraction of deciduous teeth under local anesthesia. Okay, but they have little knowledge about the X-rays, right? So they cannot be very helpful with that. Now we come to the dental hygienist. So dental hygienist, Dr. Alfred Civilian Phones, he was the person who put such ideas into practice, right? So dental hygienist is a person not being a dentist or a medical practitioner who does oral prophylaxis, give instructions in oral hygiene and preventive dentistry, assist the dental surgeon in chairside work, and manages the office. He or she shall work under the supervision of the dental surgeon. This is by the Dental Council of India. So Dr. Alfred Civilian Jones, he is called the father of dental hygiene. And the first dental hygienist was Miss Irene. Okay, Miss Irene was the first dental hygienist. She was from, I think, Newman. No, her name was Mrs. Irene Newman. Now the duties, they have cleaning of the mouth and teeth with particular attention to calculus and stains, topical application of fluoride, sealant and other prophylactic solutions, screening or preliminary examination of the patient as individuals or in group, such as school children or industrial employees, and instruction in the oral hygiene. So all these things dental hygienists do. Hygienist means related to hygiene, so he's all the calculus, clerk, and all the hygiene things you are concerned in the mouth. This is the person who will tell you about it, apart from the dentist, who is a universal package. Now, independent contractual practice of dental hygiene. So, Linda Kroll of USA started independent contractual practice of dental hygiene in 1976. So what is it? First, I would like to just read it back. Linda Kroll. So normally what we studied is that the dental hygienists are required to work under the supervision of a dentist. But in independent contracting, the hygienist have a formal agreement regarding supervision with the dentist, and often even a financial agreement. So hygienists may even practice in an office which is adjacent to the dentist office, collecting their own fees from the patient. So if this is the dentist's office and this is the hygienist, so they can have independent offices and they can be there. Expanded function dental auxiliary, which is called as EFDA. So they have been referred to as expanded function dental assistant, or you can call them expanded function dental hygienist and so on. So EFDA is a dental assistant or a dental hygienist in some cases who has received further training and duties related to the direct treatment of patient, though still working under the direct supervision of a dentist. So he is nothing but a assistant. He is nothing but a assistant. Horrible handwriting. So he is nothing but a assistant, and what he does, he has received further training. So he has received further training, and now he became EFDA. So now he can perform some extra functions. He is entitled to do some extra procedures. Okay, so they usually undertake the reversible procedures. Okay, means the procedures which they do, and if something wrong happens, that can be undone by the dentist. Okay, so the EFDA, he is in a kind of forehand relationship with the dentist. So what he does is that when the patient arrives in the clinic, so he sees him, he performs initial inspection, and he does the x-ray, and then he calls the dentist, and the dentist then examines the patient, and after diagnosis, he gives the LA, the dentist will give the LA, and he will prepare the cavity, and he will also do the pulp protection and cement basis. So after this, the EFDA will take over him. So after that, the EFDA, he will do the restoration and the other procedures. So if any problem arises, this EFDA can again consult back to the dentist. So they were called as technotherapists in Philadelphia. Okay, so there are 4 levels of training and qualification which were recognized. There are 4 levels: certified dental assistant, preventive dental assistant, dental hygienist, and dental hygienist with expanded duties. So the certified dental assistant, he does training for 8 months, and the assistant was taught traditional chairside duties. Okay, and the only intraoral duty was exposing the radiograph. So what he does some chairside duties plus the only intraoral activities that he's doing. The only intraoral activity he's doing is radiograph. Alright, now preventive dental assistant. The trainee had to be a certified dental assistant. Full-time courses were of 3 to 6 weeks. 3 to 6 weeks. Okay, and they were permitted to polish the coronal portion of the teeth without instrumentation, make impression for study models, topically apply caries preventive agents. Dental hygienist is a student who he receives training for 8 months, and he can carry out scaling, conduct the preliminary examination of the oral cavity, including taking a case history, a periodontal examination, and he can provide a complete prophylaxis, including scaling, root planing, and polishing of filling, and apply and remove the periodontal path, and apply fissure sealants. And dental hygienist with expanded duties, he receives a training of 1 year plus 4 months. Okay, so means that first 1 year he will have practical experience, and then 4 months he will do the training, right? Now they were allowed to carry out the removal of sutures, placing, finishing and polishing restorations of amalgam and resin, placing and removing matrix band, placing cavity liners, retracting gingiva for impression making, fitting and removing orthodontic bands, separating the teeth prior to banding, cementing temporary crowns previously fitted by dentist, placing temporary fillings. Okay. Now frontier auxiliaries. So in developed countries, dentists remain in the urban centers and a large number of areas are too distant from public or private dental officers for the inhabitants to receive regular comprehensive care or emergency pain relief. So in that cases, nurses and former dental assistant can in such areas provide valuable service within the minimum. So nurses, okay, and the former dental assistant, these two people can provide valuable service with the minimum of training. So simple dental prophylaxis can be performed, basic dental health education can be provided, dental first aid can be rendered in case with the pain, and the patient can be referred to nearest dentist more intelligently than would be possible by untrained people, right? New auxiliary types. So the Expert Committee on Auxiliary Dental Personnel of the WHO 959 has recognized two new types of dental auxiliary: dental licentiate and dental aid. Dental licentiate is a semi-independent operator trained for 2 years to perform dental prophylaxis, cavity preparation and filling of primary and permanent teeth, extraction under local anesthesia, drainage of dental abscesses, treatment of the most prevalent disease of supporting tissue of the teeth, early recognition of a more serious dental condition. And dental aid, this type of auxiliary personnel performs duties which include elementary first aid duties, first aid procedures for the relief of pain, including extraction of the teeth under LA, control of hemorrhage, recognition of dental disease which is important enough to justify transportation of the patient to center where proper dental care is available, and they would operate only within a salaried health organization and be under supervision. Okay, so the formal training extends from 4 to 6 months here, followed by a period of training under direct and constant supervision. Degrees of supervision of auxiliaries. So ADA defined 4 degrees of supervision. These are general supervision, indirect supervision, direct supervision, and personal supervision. So general supervision, the dentist has authorized procedures and they are being carried out in accordance with the diagnosis and treatment plan completed by the dentist. In direct supervision, the dentist is in the dental office, authorizes the procedures and remains in the dental office while the procedures are being performed by the auxiliary. Now, direct supervision, the dentist is in the office, personally diagnoses the condition to be treated, personally authorizes the procedure, and before dismissal of the patient, evaluates the performance of the dental auxiliary. And personal supervision, the dentist personally operating on the patient and authorizes the auxiliary to aid treatment. So he just helps him aid treatment by concurrently performing supportive procedures. Dental manpower in India. So the first question I have is, do we have a future? I don't know. So dentist in 2004, the scenario was that in urban areas there were 1:10,000 ratio. For every one dentist there were 10,000 people, and the rural areas there were around 1:2.5 lakhs. And when you talk about the dental assistants, hygienists, there were 3,000 registered hygienists in 1990 and 5,000 laboratory technicians. So there are a lot more dentists in India than really required, and there is no job. So I really don't know what future we are having. But just let's have our finger crossed and see what happens. I hope you like the video. Please be sure to subscribe, share and comment. Thank you so much. Allah Hafiz.